Welcome to Amazing Insight. Today we have a very special person with us today. I'm Octavia Trim, and we have...
And I'm Bill Hester, and we really want to thank the Zavita Corporation and with its Zeal for Life, a supplement formula, because today you really want to get on the phone, call some friends, call anyone you know who have pain and discomfort, because today we have a phenomenal show on. And today, Octavia, our special guest today, Dr. Scott Denny. So welcome to the show.
Welcome, welcome, welcome.
Thank you for having me. Thank you.
We're so honored to have you here with us today, and you have so many accolades behind your name that I was going to actually read the list, and it goes on and on and on. But Dr. Scott Denny has just remarkable work that he's doing with he and his colleague here in South Florida. They're doing something with the healing and pain that a lot of people are experiencing here, and it is something that is really phenomenal, and I'm just so honored to sit here and talk with you about that today.
Thank you.
You have a technology that, and we're going to just name this segment, Healing at the Speed of Light.
Yes.
Healing at the speed of light, and that's what we're going to be talking about today. This is about laser therapy. And you're a doctor of laser therapy. It's called the MLS Laser. Am I correct?
That's right. MLS Laser Therapy stands for Multi-Wave Lock System.
Okay.
It's a patented type of laser designed for treating a variety of different pain conditions.
Okay.
And non-healing wounds and acute shingles and neuropathy and a variety of health concerns.
Wow.
Dr. Denny, I have to say, when we visit your office, this machine looks something like out of Star Wars or Star Trek, and I was just amazed at the technology.
Yes.
And so tell us, what makes this machine so unique?
Well, I've been using laser therapy for a number of years in practice. Initially, the only lasers that we had to use when treating patients were known as the low-level lasers. Those lasers have a very, very small amount of energy output to them, although they're very effective in treating a variety of concerns. The high-powered lasers, which the MLS laser belongs to that family of lasers, is unique in that it has the synchronized pulse of 2 wavelengths of light, which help to reduce pain, swelling, and inflammation simultaneously. One of the other benefits of the machine is that it does not have the thermal side effect that most lasers do. When most of us think of lasers, we think of cutting.
That's correct.
And in surgical applications, that would be the desired effect of the laser, combining the power with the optics in order to get a beam in order to cut tissue, for example. But the opposite is true when you're trying to use therapy in the form of laser light to treat conditions. You don't want the heat.
That's right.
It's not a heat therapy, it's a light therapy.
A light therapy.
So we want to avoid the heat that is commonly associated with the high-powered lasers.
I like that.
Yeah, so this particular product accomplishes that goal by synchronizing the pulse of the 2 waveforms of light in such a manner that there is no appreciable thermal effect whatsoever. So it is safe to use for not only treating back pain and neck pain and arthritis and tendinitis and neuropathy and things of that sort, but it's also safe to use with patients who have implanted metal devices. So if a patient has a knee replacement or a hip replacement or a prior spine surgery or something along those lines, it is safe to use this machine over those areas to help speed healing at the speed of light, as you said.
Yes.
However, we do not have to be concerned about producing heat in the metal substances that have been put into the patient's body. It is the only laser in its class that is capable of doing that, and that's why we chose that technology to use in our practice.
And that's what I found that was really exceptional about this laser, because of the fact that you said there's not a heating element in it, but it does go to the cellular level and molecular. And I'm not saying that word right. Molecular level to achieve what you're trying to achieve with the healing.
That's correct.
And that's amazing. That is very amazing.
Now, Dr. Denny, do you find that initially, because when I first heard this laser, I'm thinking like everyone else, okay, something's going to cut the body in half.
That's right. That's what everybody thinks.
How do you get around the initial introduction that this is not the same type of technology?
That's a very, very interesting and very, very interesting point that you bring out. It is a hurdle that we need to climb over, especially when you look at the fact that other lasers that are therapeutic in this class do have a thermal effect.
Yeah.
And that if you don't keep moving the laser, you can injure somebody.
That's right. That's right.
It's just a question of education, and we do run regular educational seminars in the office and in local establishments when we invite the public to come. And I do a presentation.
Okay.
I do try to keep the laser physics down to a minimum because it can get very boring.
Yeah. Okay.
But ultimately, it's all about the education of the individual, and they have to understand that there is no cutting or no heat involved, and they can't be burned or anything along those lines. Unfortunately, misconceptions about laser abound.
Yes.
We have one slide in one of my presentations that I do when we do our lectures of James Bond lying in a table. Maybe the movie Doctor No, I'm not 100% sure.
Okay.
Yeah.
And there's this red laser cutting through the table
Right.
at him.
Oh, yes, I
yes.
do remember that episode. I do remember that.
And that's what most people's perception
Exactly.
is.
Okay. No, that's not good. That is not good. Well, you only have, and from what I'm understanding from what you were saying and what I was reading about this technology, there's only 2 here in Florida. Am I correct?
There are 2 MLS robotic lasers, one in our Fort Lauderdale office and one in our Davie office.
Okay.
There are other MLS lasers that are scattered about. There are probably a few others.
Okay.
However, we have the distinction of being the first pain practice in South Florida to use this technology. We've been using it now for several years, and we've performed thousands and thousands of treatments, which has really allowed us to hone our skills in applying the treatment for a variety of conditions. So at this point, we're able to customize
Yeah, I know
patient
you
protocols.
talked about not only pain and discomfort, but you also had things like shingles and psoriasis.
That's correct.
And so it had multiple uses.
That's correct.
Yes.
Laser therapy is used for a variety of conditions. There's extensive literature on laser therapy being used for many things, from non-healing wounds to venous ulcers to diabetic neuropathy to nerve damage caused by chemotherapy,
Whiplash.
neck pain, back pain, sciatica. Now, it all sounds really good that you can, to some people it sounds too good to be true, and as lots of our colleagues have said, this can.
How can you do this? But it's so new. This is new.
Well, this particular product is new, but the laser research is pretty extensive. As I said, there's well over 3,000 published papers on the use of laser therapy for treating a variety of conditions, as well as to date, over 130 randomized controlled clinical trials using laser therapy for a variety of conditions.
And that's good to know.
Yeah, and on average, there's somewhere between 250 and 300 new scientific papers published yearly around the world.
Okay.
So the laser does have many different applications because the cells do respond to light. And as Octavia was saying, we have a technology that stimulates at the molecular level. It stimulates what are known as chromophores, which in turn excite the mitochondria of the cell, which is the energy portion of the cell, to allow the cell to repair itself and to allow it to produce energy and repair itself. While all of that is going on, it's reducing pain, it's reducing swelling, and it's reducing inflammation. It also increases circulation to the area and has little or no side effects whatsoever. So it has tremendous upside potential for patients who have these types of conditions.
Yes.
And very little downside. And one of the most beautiful things about this technology is that it doesn't take years
To do.
to do.
That's right.
Okay.
And you don't need a pill.
Right.
You don't
And
need
you
a
don't
pill.
need hospital time. You don't need to be cut.
It's got a lot of good things.
I
And
think
your
that's
success
wonderful.
rate is very high.
Yes, the success rate is extremely high. The positive response rate to the laser is about 90%, which is unheard of.
Okay, so an average, now let's say an average for you to see how well a patient is doing with this type of therapy
Yes.
is about how long on average?
You need to apply the therapy for a couple of weeks, so probably 5 treatments or so, in order to see if it's going to benefit. That allows us to start with protocols that have been established, and it also allows us to customize the protocols for that particular patient in order to try and stimulate the healing of the patient. If the patient has a successful response to the trial course of care, which are those first few treatments, then it's recommended that the patient continue on for the full course of treatment for a long-standing or chronic condition. That could be somewhere between 10 and 15 treatments,
Okay.
at which time the patient will be discharged and supportive care will be recommended. For an acute situation or a new injury, something you just did, sports-related type injury,
Pull
things
your
of that.
back out.
Pull
trying
your
to-
back out.
Trying to help the wife around the house.
Right, doing the honey-do list.
Are those up north shoveling snow? And
Yes, there you go.
Wow.
Now, with the laser, are there any supplements or any type of...
Yes, there are protocols that we have in place to help stimulate the body to push the healing process. The first thing in our practice is we do assess a patient from an integrative perspective. We want to know what's going on with that patient's nutritional status, how are they eating, their lifestyle issues, are they drinking, are they smoking, are they supplementing, are they not?
Are they diabetic?
Exactly.
Because
So,
healing
a
is
big
not going to
part-
be as readily.
That's right.
Or what you do is that people consider a change of lifestyle.
That's correct. Lifestyle medicine, it underlies every treatment that we provide in our office. And of course, laser therapy with the MLS laser is only one of many different types of services that we do provide in the office. We provide acupuncture and oriental medicine. We provide chiropractic services, therapeutic massage, vitamin injection therapies, and things of that sort. So, nutritional counseling, lifestyle counseling.
That's excellent.
Yeah, so
So you have the whole, you have the whole gamut. In the
Yes.
office, everyone is able to benefit from all of these healthy, programs that you have available to
That's
them
correct.
to facilitate the healing
Yes.
in every way.
So if a patient comes in and, as we said, they're diabetic or something along those lines, we do want to address their lifestyle issues, because as we know, food is either medicine or it's poison.
Absolutely,
So
absolutely.
the lifestyle issues underlie everything.
That's
and,
right.
And it's very important, and we would be remiss if we were just simply focusing on their pain and not addressing the whole body and trying to get them onto a healthier path in order to heal not only what they're presenting with, but prevent future disease and,
That's right,
and,
that's
and all other kinds
That's
of
right.
problems that can occur.
Now, Dr. Denny, you have what you call a free examination to initially get started or something?
Well, we because it's a new technology to most people,
Yes.
we're very, very happy to offer a complimentary consultation.
Yes.
If patients come with some imaging studies, I'll be more than happy to look at them. I'll be more than happy to offer my suggestion to them as to what would be the best course of care. But again, to me, the most exciting thing about this technology is that it has a beginning, it has an end, it doesn't take years to get it done, and we can give patients who have been suffering for years, in many cases,
Oh, yes,
relief within a matter of a few treatments.
Good example of that. Well, tell us the story that you were telling us about the young lady who had the nerve problem.
We had in our practice, when we first received the laser and we started to use it on most of the patients in the practice, one of our patients is a young lady, she's still a young lady, who was wheelchair bound, who suffered from what is known as complex regional pain syndrome or reflexive sympathetic dystrophy. This is a painful condition where she had an injury to her ankle and foot, and rather than simply healing, the sympathetic portion of the nervous system was overexcited, and a pain syndrome develops as a result when there's swelling, there's redness, there's acute sensitivity or severe sensitivity. You couldn't even touch the area. She had so much pain from it. This is a condition that will oftentimes require interventional pain management in order to break the cycle, but we are finding that with laser therapy we can effectively break that cycle by treating it with the MLS laser. And she underwent the MLS laser, in her case, for an extended period of time because this was a very significant
and severe
case. And now the young lady is, I'm so pleased to say, and it gives me goosebumps, you know, that she's walking and gardening and no longer has to use the wheelchair as a result. But we have many patients.
Well, Doctor, that's what I want to say.
Yeah.
From what you've done thus far, most of your business is from referrals.
Yes.
Simply because people are so amazed at the relief they've gotten and the comfort that they receive.
Yes. Yes.
So they're going out and spreading the word, and I'm pretty sure a lot of people looking at the show now wish that you was in their area.
Well, if anybody who's watching the program is not in our area, we will do our best to try and point them in the direction of a colleague that might have the equipment who may be wherever they may reside. There are several thousand lasers, MLS lasers, that are out there, and they're in a variety of different practices.
Okay.
It originated in the veterinary world. The first laser that came from Italy, from the ASA company who makes the MLS laser, introduced it in the United States into the veterinary world.
Is that right?
And one of the attractions, of course, to the veterinarians was the same reason that attracted me, is that you won't burn anybody.
Exactly.
You won't burn the animal in applying it. And of course, dogs and cats and what have you have non-healing wounds and arthritis, just like humans do. And several years after that, they introduced the MLS M6 robot, which is what we have. It is a robotic laser.
Yes.
And since then, there have been thousands of machines that have been sold to a variety of different practitioners. There's a tremendous number of podiatric physicians, foot doctors, that use this machine, either in its robotic form or not, to help patients with foot pain. And now there are dentists who are purchasing the smaller handpiece unit to use for treating temporal mandibular joint syndrome.
Wow.
So it's not unique to us. We have formed an organization. It's called the Laser Pain Management Association.
Okay. And someone can go online and just go to...
Yes, they can Google or Bing or Yahoo, whatever they decide to do these days, the Laser Pain Management Association, or there's a link through our website, davylasertherapy.com.
Okay.
On the bottom of the homepage is a link to the Laser Pain Management Association.
Oh, lovely.
So we are conducting ongoing data collection, outcomes data collection, to improve patient treatment protocols. So we are doing clinical research with patients who are coming in for the treatment.
That is amazing.
Yeah. So we're doing a lot of things with the product.
The one thing that I really liked about it, and this is an issue that I've suffered with, and I'm sure there's a lot of other women that have suffered with this, and that is toe fungus. Okay? You go to the nail salon, you go to get your nails done, and next thing you know, you have a little fungus on your toe or on your finger, and it is tough to treat. I've even gone to the doctor gotten a prescription, and it takes months.
Yeah.
It's so slow. It takes months to apply the application, apply the whatever they give you
Yes.
to the area, and sometimes it doesn't even work.
That's correct.
So
Nothing works 100%.
No.
For toe fungus, and part of the issue with toe fungus is that there are many different fungi
Okay.
that infect people. So there are many different types of fungus.
So you may not even have the right application for that particular fungus on
Right.
your foot or nail, and that's the reason why it's resistant and won't go away.
Yes.
Whereas if, ladies, you take note of this, if you go to Dr. Scott Denny's laser therapy office, you can go and get a session done and get it eradicated. And I'm pretty sure it won't even take too many sessions to even take care of that.
We apply the same model that we do for any other condition. We would apply a few treatments over a couple of weeks
See
and
how
we would
it's
see how it
responding.
responds. Dr. Lucio Zaghetto, who invented the MLS laser from Italy, presented a paper at our last laser pain management conference, and they are actually looking now at the different types of fungus and seeing which ones are responsive to the wavelengths of light that the MLS laser emits.
Oh, I like that.
Yeah, so
I like that.
there'll be more coming out about that.
Yes.
And we're also designing, and hopefully shortly we'll launch a nationwide shingles trial.
Yes, because that
where-
is
yeah.
very big, very big. We have a lot of
Very
people
shingles.
over the
Yes.
age of 50. This shingle virus has been coming back with a vengeance.
That's right.
And very painful. Very painful.
The laser will destroy the virus,
Okay.
and because it's so quick to heal any type of skin condition, you can usually take care of acute shingles within about a half a dozen treatments or so.
Dr. Denny, we want to take a moment and let's get some contact information from you, because I'm pretty sure a lot of our viewers are going to want to know who is in their area and who would you
Sure.
recommend in their area. So
Sure.
take time and tell us.
Well, we have two locations. One is located in Fort Lauderdale, and the phone number for that office is 754-200-1555. And the office in Davie is, of course, West Broward County. Is the phone number for that office is 954-473-8925. And you can always visit our website, davielasertherapy.com, for more information about that particular service. And it also has information about some of the other services that we provide in our practice.
Okay.
In the offices.
Did you tell them where you're located actually in Davie on University
We're
Drive?
right on University Drive, right off of 595. You can't miss us. We're across from the Tower Shops.
Yes.
And we're right near, currently in Fort Lauderdale, we're right near Holy Cross Hospital.
Yes.
So we're
Okay.
very, very conveniently
Very close.
located.
That address, by the way, on University Drive is 2215 University Drive in Davie, Florida. And you can just stop by the clinic, get a consultation, talk to him about whatever you need as far as healing is concerned in your body. We thank you. We thank you, Dr.
and I
Scott
thank
Denny,
you.
for joining
Thank
us
you.
today on Amazing
It's my
Insight.
pleasure.
And we're just so honored to have you here doing phenomenal work and healing with the healing speed of light, called the MLS therapy session. And you want to definitely get a hold of Dr. Scott Denny. Thank you so much for
Thank
joining
you.
us
I want to thank
Yes.
both of you for having me. Thank
It's
you.
wonderful to have you. It was nice to get a chance to look at some of the Star Wars stuff you got in your shop. It really looked like we're into the future when we was at his place. So please go by and visit him. And thank you for watching our show. And join us again for another Amazing Insights.